to the world. Subscribe now to the Hot 97 YouTube channel. It's Ebro in the Morning with Laura Stiles and Rosenberg.
Look, Ebro, Laura, and Rosenberg every morning. This morning we have a special conversation and some time with the great Dr. Fauci. Welcome to the program. How you doing?
I'm well, thank you. Thank you for having me.
Of course. Brooklyn native, right?
Indeed. Yes.
Bensonhurst, yes. So before we get all the way into talking vaccine, how many presidents have you worked for or worked with?
I've worked with soon to be 7. Started off with Ronald Reagan and all the way up through finishing off with President Trump. And next week, it'll be my 7th president, President Joe Biden.
And so it's been, and how does your relationship and your job work with presidents? They select you as the guy, or the organization you work for is the organization they turn to when we have an infectious disease issue to deal with?
You know, it's just evolved that way. My main day job, if you want to call it that, is that I'm the director of the National Institute of Allergy and Infectious Diseases. So not a lot of people know that, but we either do the research or fund the research for all of the infectious disease outbreaks, particularly in the United States, but even globally. So we're responsible for the research on HIV, AIDS. We were very much involved in developing of the drugs that are now really transforming the lives of HIV-infected individuals, malaria, tuberculosis, influenza, all that. But how I got involved with advising presidents is that early on, when there weren't very many people who were willing to step up to the plate to do something about HIV, I did. And I got the attention of then President Reagan, who then sort of like handed it over to President George H.W. Bush, who I became friends with in the sense of that he was listening to me for the first time about the importance of what we needed to do, particularly because it was almost all a disease of gay men at the time and injection drug users. We didn't even know that it was prevalent in Africa, mostly among heterosexuals. But I got to develop a relationship with President George H.W. Bush as an advisor, as sort of like a second job. My main job was running a big institute, but when it became to what the policies would be, as the country addresses infectious diseases, and as subsequent presidents came, Bill Clinton, then I became an advisor to him and to Hillary. And then when it came over to George W. Bush, the same thing. Remember, we had the anthrax attacks, we had to get the country prepared. So George W. Bush asked me to lead the research effort on that, to develop vaccines and countermeasures. And then we developed the PEPFAR program together at his inspiration. Got to give him a lot of credit for that. And then the 8 years with President Obama, and when we had a lot of infectious disease challenges. You remember influenza, Ebola, Zika. So it just happened that because of my interest and expertise in infectious diseases, that the presidents got to know that they could count on me for giving them non-political, unbiased, scientific advice, as opposed to getting involved in the politics, which I've successfully done for all these years, is to stay away from the politics so I could advise a Democratic president as easily as a Republican president, because I stay out of the politics and concentrate on the public health.
Well, congratulations on staying out of the politics this time around, because they tried to drag you in.
I was going to say that. They tried to get you.
Yeah.
How different is we're almost 1 year to a T from when this whole thing started. Is this where you would have guessed we would have been with COVID-19 a year later, or should we have been in a better place than we are?
Well, certainly I would have liked us to have been in a better place. I have to tell you, throughout all the years that I just described, people would always ask me, what's your worst nightmare? What keeps you up at night as a public health infectious disease doc? And I would always say that, there's something that's very clear. It would be a brand new infection that jumped species from an animal reservoir, that was a virus that was spread by the respiratory route, that was very efficient in spreading from person to person, and had the capability of making a lot of people very sick and killing people. And unfortunately, that's the nightmare that we've been living through, all of us, over the last year. So this is something that in the back of your mind, you kind of said this would be the worst possible scenario. And then all of a sudden it happened. So it's really unpredictable. I would have liked for us to be in a much better place now in the sense of having contained. But one of the unfortunate things that I think you alluded to a little bit about good luck about staying out of politics is that instead of this just being a public health issue, it was very, very much dividing the country, because we have a very divisive society as it is right now. You don't need me to tell you that. And when you're trying to do a public health measure in getting the country together, pulling together to stop this outbreak, it becomes very difficult when it becomes politicized, when wearing a mask or not becomes a political statement. There's no room for that when you're dealing with a catastrophic outbreak. But unfortunately, that's what's been going on over the last year.
Now, Dr. Fauci, early on in the coronavirus, politicians, everybody made mistakes about what to actually do. And some of those mistakes, get brought up even today because people are not accustomed to our medical professionals not having answers. Right. And so early on, people acted as, and they point to you and say, well, Dr. Fauci said that we didn't need to wear a mask early on. How come he changed his story? Or how come this changed? Can you talk through how much your world, people that are dealing with it like you are, had to change and evolve and learn? Because we're doing this. This is a live exercise. This is happening right now. And so there were things that you guys just didn't know.
I thank you for putting it that way, because I think that's one of the things that people don't understand. When you're dealing with an evolving outbreak, when you start off at day one, you know nothing. So on day 2, 3, 4, 5, you learn and you learn. But in real time, you have to be making recommendations and guidelines. You have to be humble enough and flexible enough to know that when new information comes, you've got to be able to say, now we know something we did not know a month ago or 2 months ago. So we've got to change it a bit. And it isn't like flip-flopping. It's deciding things on the basis of the current evidence and data. So let's take the really important point that you made. When we were in January and early February, there were certain things that were going on that we knew and that we didn't know. There was at the time a shortage of masks. So even the healthcare providers who were courageously putting themselves on the line to take care of patients, many of them in New York, because at that time, New York was the epicenter of the outbreak. They were running out of personal protective equipment. So at the time, we did not know that masks worked. The other thing we did not know is that 50% of the people who were infected had no symptoms. Mm-hmm. So you couldn't rely on just staying away from someone who was sneezing and coughing the way we usually do with respiratory diseases. So there were 3 things that were going on. A shortage of masks. We didn't know masks worked because we didn't do any studies then. And we didn't know that the virus could be spread from someone without symptoms. As soon as it became clear that you could use cloth masks that you could make industrially by the hundreds of millions, all of a sudden, there was no shortage of masks. At about the same time, it became clear from the studies in other countries that masks actually worked to prevent you from infecting somebody else and to prevent someone else from infecting you. And then the big thing that we learned, and that was not until, a month or more into the outbreak, because the Chinese were not being terribly honest with us. We had to find it out, that many of the infections are spread by people who don't even know they're infected. They're feeling perfectly well. So on the basis of that, we went from saying, save the masks for the people who really need them, the healthcare workers, to where we are right now, that everybody uniformly should be wearing a mask because of the undetected kind of asymptomatic infections that are getting spread. So that's the reason why things evolved as we got new information and new data.
And so even with, on this program, we started talking about this virus shutting down cities in China in February of last year, because we have friends over there who are DJs, and one of our guys who's a DJ said, hey man, there's something going on in China. They shut down Wuhan. Wuhan is a city of 10 million people or 8 million people. That is serious. That is crazy. We started talking about it on the air. I think Rosenberg, we bought our first mask, the end of February, beginning of March? I bought them on Amazon, and people were making fun of me on the air like, you tripping. I'm like, fam, they shut down an entire city. What is going on out here? So even with that information, Fauci, at the time, how did you and your team, how were you guys processing that information? And what were you able to discern? Because there was definitely conversation that I believe, if there was a different administration, because when it was Ebola, when it was these other things, it felt like listening to the World Health Organization was the thing to do. When it came to this one, all of a sudden the World Health Organization was the enemy.
Yeah. Well, that's true, and hopefully that will change. I mean, you're right on it. You're calling it exactly like it happened. One of the things that we wanted to do is that because of this extraordinary tension between China and ourselves, which was really unfortunate, is that we wanted to get our people to go there to China and to Wuhan and to answer the question that you just posed beautifully. Like, what the hell is going on in Wuhan? But what happened is that it took quite a while to get any team over there. And when we got there, they wouldn't let our team, the USA team, the person that I sent, they wouldn't let him into Wuhan. They let him into Beijing, but they wouldn't let him into Wuhan. But, there were things that were going on in there that clearly, you're absolutely right. The distrust between China and ourselves was not helpful in trying to say, hey, listen, this is really going on. Because what the Chinese did in the beginning, which was really unfortunate, in that it made it look like this was a virus that spread only from animals to human and didn't spread efficiently from human to humans. And we were kind of had blinders on there, like, what is going on? We need to know. And then it said, well, it is spread from human to human, but not particularly efficiently. And then we find out it spread really efficiently from human to human. And then all of a sudden, the real clincher was that not only is it spread from human to human, but people who have no symptoms are spreading it.
Right.
Now, if you go back to the system that we set up here, it was generally what's called a syndromic syndrome, which works beautifully for flu. Because with very few exceptions, flu transmits when someone is sick, not predominantly. So we were saying, wait a minute, what's going on? We're not really seeing anything here syndromically in the country. In the meanwhile, under the radar screen, it was spreading around because of the fact that it was spread by people who had no symptoms. Now that we know that, that's one of the real reasons of why we're saying we've got to do a lot more testing, and we've got to test people who have no symptoms, because they are the ones that are likely driving the outbreak.
Dr. Fauci, we hear from a lot of listeners who, in many cases, are skeptical about this vaccine. And I think underrated is that in many cases it's reasonable for particularly black folks in this country to be skeptical about what's being handed to them, in this case by the government. And plus there's this interest in it being taken in the black community because that community has been disproportionately affected. And I understand that skepticism. What can you say to our listeners who have skepticism and just feel the research isn't there and they're worried about the long-term effects of this vaccine?
Yeah, well, I've been spending, I have to tell you, and it's worth it, a considerable amount of my time reaching out to the African American and brown and black communities. For the first thing to say, your skepticism and your hesitancy is understandable on the basis of the history of how brown and black people have been treated, particularly African Americans, by federal government health things, going back again to that infamous situation with Tuskegee back decades and decades ago. So that's something you don't forget easily, particularly when your grandparents tell your parents and your parents tell you. But the fact is, one of the things that's so clear and would be really tragic is that disproportionately brown and black people are afflicted more by COVID-19 because of the nature of the kind of jobs they have, which are usually out in the community doing things with people as opposed to behind a computer.
Essential workers.
It's exactly. So they have a greater chance of getting infected. Once they're infected, because of all of the social determinants of health that have gone against brown and black people for years, they have a higher degree of underlying comorbidities that make it more likely that they will develop a serious disease and possibly death. So when you look at the hospitalizations per 100,000 and compare African Americans, Latinx, Native Americans compared to whites, it's multiple times more likely that you're going to get hospitalized. When you look at deaths, it's a couple of times more likely that you'll die. So if anyone needs this vaccine, it's people who have a higher propensity for getting serious consequences. So that's what we've got to fight against by saying, putting aside the history of mistreatment, because there are safeguards in place now that will never let that happen. It just won't. And at the same time, you admit there have been those infractions in the past. What's going on now won't let that happen. So you ask brown and black brethren, what is it that makes you hesitant? They say, well, you really went too fast. Well, yeah, it's the fastest we've ever gone from the time you recognize a virus to the time you actually get the vaccine into a person. That speed was not sacrificing safety or scientific integrity. What it was the reflection of spectacular scientific advances in technology of developing vaccines, which allow you to do in months with a year ago, 2 years ago, 5 years ago, would have taken years to do. So then you say, well, okay, how do you know it's safe and effective? Is this the government giving us a bunch of hulu? Or is this the pharmaceutical companies want to make a bunch of money? It's really neither, because the determination if something is safe and effective is made on the basis of clinical trials that had tens of thousands of people in them, including a good representation in many of them with African Americans and Latinx. The next thing is that the determination of whether it really is safe and effective is not made by a government official or by the pharmaceutical company. It's made by an independent data and safety monitoring board who are beholden to no one. They don't answer to the government. They don't answer to the pharmaceutical company. They just look at the data and then they determine this is safe and effective. Then when the FDA makes their determination, should we let it out to people, they do it in association with an independent advisory committee. So what you say is, okay, let's look at this. The speed was not reckless speed. It was scientifically driven speed. And the determination of safety and efficacy was made by an independent and transparent process, which is the reason why I keep saying I got vaccinated. So if I was worried about it, I wouldn't have gotten myself vaccinated. So that's why we reach out and say, this is good for your own health, the health of your family, and the health of your community.
Fauci, we have limited time, and I'm hopefully have another conversation with you for Black History Month, and we'll dig more into this vaccine. One thing I want to leave you with, for Black folks, the question also is, why do y'all care about us now? Right after all of these years of different ways of oppressing us, whether it's through jobs and food, access to healthy food for our neighborhoods, and et cetera, et cetera. That's a lot. That's the question for a lot of people. I also, too, before we get off of here, how long will we know before this vaccine prevents you from actually carrying the virus or not? Because I know that's still unknown.
Yeah, good question. We know for sure it protects you against getting sick with symptoms, for sure, 94 to 95%. It's going to take several more months and maybe longer to determine if it actually prevents you from getting infected, because it's conceivable that it would prevent you from being sick, but you still might carry the virus in your nasopharynx,
Right.
which is the reason why even when you get vaccinated, you still should be wearing a mask until we know the answer to that question.
Dr. Fauci, it was a pleasure. We hope to have you back on again and have some more conversations and keep this momentum going, because this is a historic moment for everybody and everything that we're dealing with. Forbes just put out an article yesterday that said 1 in 500 New Yorkers have died from the coronavirus. So I don't know if everyone is really processing the magnitude of this moment in history that we're living.
Thank you, Doctor. We appreciate it.
Thank you. Good. Thank you for having me. I really appreciate being on your show.
Thank you very much. See you soon.
All right, take care.
Right.